Coming up on It's Personal, think the flu season is over? Well, think again. We're going to talk with infection control preventionist Meller about what we're seeing in the La Crosse area, and we'll also ask her to debunk common misconceptions regarding the flu shot. And a little bit later, the opioid epidemic. Well, it's in our backyard. But how bad is it? Dr. Eberlein will give us his perspective and talk about the potentially deadly drug carfentanil as well. That's all on It's Personal, brought to you by Gunderson Health System.
You know, house calls aren't typical anymore. But as a Gunderson cardiologist, I do the next best thing: outreach visits to my patients in rural clinics and hospitals. I love that I can bring care closer to home, especially when they're ill or the weather is not good.
At Gunderson Health System, our doctors go the extra mile, or 60, to provide care for patients. It's the driving force behind love plus medicine. Learn more about Gunderson hospitals and clinics at gundersonhealth.org.
Welcome back to It's Personal, brought to you by Gunderson Health System. I'm Chris Stauffer. Everybody's talking about the flu. The flu is something that's not only in the news, but certainly hospitals and health systems, not only in the greater La Crosse area, but really across the country, are concerned about the flu. It's to the level where people are dying from the flu, and this is sort of like that worst case scenario if you really want to talk about that. Joining us now is Meller. She's an infection preventionist here at Gunderson Health System. Thanks for joining us.
Thank you, Chris.
The flu is really kind of taking over the country right now. Can you give us the latest?
So the latest is that right now we're hitting peak levels of influenza, although when this peak is going to decrease, no one knows. It's just a matter of looking at the number of cases. But influenza is widespread across the entire continental United States.
Yeah, what is the CDC saying about the flu? Why it's out there so prevalent this year? What's different?
There's no really true difference with this virus this year, although H3N2, which is the predominant influenza strain that's affecting the entire country, does tend to be a little bit more mischievous than H1N1. It tends to affect the elderly and the young more so than H1N1.
And we've seen several deaths, young people dying, and that really gets our attention when that kind of thing occurs. I
Absolutely.
know California hit kind of hard with the flu.
And I think the last numbers from the CDC were that 63 children have passed away from the flu. When you actually look at those numbers a little bit closely, it seems that 80% of those children were not vaccinated against influenza this year, which raises the important question of why is the flu shot that so important anyways? And so that's been pushed to the forefront this season.
Right. The other thing that's been pushed to the forefront is the effectiveness of the flu shot. You're probably tired of answering that question about why not as effective, because you get the flu shot, you're hoping that it really does the trick, but there still may be some reason for getting the flu shot. It still might be helping, despite the fact that it's maybe not hitting the strain as hard as...
Absolutely. Yeah. Well, I think there are some misconceptions with vaccine development. I think people want to either have a lot of faith in science or don't have faith at all in science. But the way the vaccines are developed is to target the virus itself, so that way your body can develop a strong immune response against it. But viruses are tricky. They are constantly changing their genetics around, which would then make vaccines a little bit less effective. So early in the season, the CDC came out saying, based off of data from the Australia flu season this summer, that our flu shot was only going to be 10% effective. Now, current estimates are going to be closer to about 30-35% effective. One of the problems with H3N2 is that with the way the vaccines are developed, it just tends to change a little bit more rapidly during that process compared to H1N1, which is a little bit more stable. So that affects the effectiveness of the vaccine, as well as just natural variation of the virus that's circulating in the community. That said, getting the flu shot is likened to wearing a seatbelt. In a car, you get into a car, you buckle up, and you know that even then, wearing a seatbelt, that there's still a chance if you get into a car accident that you might get injured, or you might get injured pretty badly, and you might even die. But wearing a seatbelt dramatically reduces the risks of either of that. Getting the flu shot's the exact same way, and we're seeing it with these healthy kids. If you get the flu shot, And then a month or two later, you get the flu. You're going to think, well, it wasn't effective. I got the flu shot. But at the same time, your disease is going to be less, probably a couple days shorter compared to someone who wasn't vaccinated. And your symptoms are going to be less severe, which is really important because a lot of the deaths that we are seeing associated with these young unvaccinated children and even healthy adults is due to secondary pneumonia, which comes like about a week or two after your body is done fighting off the flu, your immune system is weakened, and then all of a sudden you get this bacterial infection and your body just doesn't have the strength to fight it off. And that's what's landing a lot of these people in the hospital or suffering from cardiac arrest.
When do you know it's time to go in and get looked at? What are the signs and the symptoms that say, hey, it's time for you to go into urgent care, or should I go to urgent care, or should I go right to the emergency room?
If you're experiencing a high persistent fever, so we're saying anything above 101, and if you're feeling having that shortness of breath, you're wheezing, definitely go to the emergency room. If you're even if you were having troubles keeping food down or nausea, anything like that, go to urgent care, go to the emergency room. It's not a time to mess around.
Staving off the flu is something that a lot of us would just like to try and do. And from what I've been told, just avoiding people who are sick can make a dramatic difference.
Absolutely. I mean, one of the things we advise people, and you see the CDC, medical professionals saying the same thing, is if you have the flu, the best thing you can do for yourself and for others is to stay home. Stay home from work, stay home from running errands, stay home from family events. Basically quarantine yourself until the bulk of your symptoms have resolved, because you will protect other people. But, I have a lot of respect for the microbe, and I don't think you should live your life in fear either. So you can go, I got a cold earlier this year and I wasn't around any sick contacts, but there's going to the grocery store, you can pick something up. And so it's best just to focus on yourself, focus on your best hand hygiene. So washing your hands after you blow your nose, covering your cough appropriately, and just being mindful of yourself and taking those steps will be some of the best preventative measures to keeping you healthy this season.
And you and your family.
Exactly, absolutely. And your coworkers. No one likes to have workplace epidemics where your coworkers are coming in sick and they're touching the copier, different mouses, communal items, and then suddenly you're exposed, and then it keeps going around. No one needs that, and it also affects workplace productivity.
Yeah, is there sort of a general rule about going to work? I know it's probably different for every company, but how do they handle things at Gunderson, for example?
So we have this phrase in infection control, when is sick too sick, that we've partnered with Employee Health. And on our website, it's just, if you're sneezing constantly, but it's due to allergies, come into work that way. If you have a cold and you're constantly blowing your nose, you don't have time to perform hand hygiene in between, then you probably should have stayed home, because you can't take care of those basic functions. If you have a fever, so one of the things with the flu is the fever associated with it and the aches, we recommend that you have to be fever-free for 2 days without the use of fever-reducing medications such as like Tylenol or ibuprofen. And once you're free from that, then definitely come back into work. I mean, I know no one likes to use up their PTO for something like the flu. They want to save it up for vacation and family events. But really, you just got to take care of yourself, because the faster you take care of yourself and the better you take care of yourself, the better you will be in the long run, and your family.
Really good point. Megan Meller is an infection preventionist at Gunderson Health System. We're going to take a time out. When we come back, she's going to talk more about the misconceptions over the flu shot. Is there mercury in there? Is the flu good for someone who might be pregnant? We're going to talk about those things and much more when It's Personal continues. It's Personal is brought to you by Gunderson Health System.
Dear Gunderson, my mom told me to write a thank you note for the cool bicycle helmet you gave me for free. It's the same color as my bike, which is mostly blue and some green. I like to wear it so if I crash, like my friend Charlie, I won't get stitches in my head. Charlie said stitches hurt a lot. You're nice. From your friend, Jeremy.
Welcome back to It's Personal, brought to you by Gunderson Health System. I'm Christopher, and again, joining us is Megan Meller. She's an infection preventionist at Gunderson Health System. She's in the infection control department. Very busy person with the flu going around, just trying to monitor the number of cases coming into Gunderson. Maybe you should just touch on that. 10, 15 per day coming in still?
Right now we're still seeing about around 10 confirmed cases, but those are dropping off because providers are not testing as frequently anymore for the flu. Patients are coming in for a checkup or coming into urgent care with flu-like symptoms, and they're just being treated appropriately and they're not being tested, which it's a fairly common practice this time of the season, is to see those confirmed cases start to drop off.
We want to talk to you about misconceptions over the flu shot, stuff that people hear in the community. It's out on social media. It's kind of all over the place. Somebody says, hey, I got a flu shot. Next day, I got sick.
So there's a couple problems with that. So the purpose of a flu shot is to boost your immune response. And so some people will report feeling a little off, a little achy the day after they got their flu shot. That's actually a really good sign because it means their immune system is recognizing, these antigens that were, placed into them and actually developing a really strong, good immune response. So that's perfectly fine. Now, there will be some people too who get the full-blown flu right after they get the flu shot, and they will be like, nope, the vaccine gave it to me, and that's also very inaccurate. So it takes the flu about 1 to 3 days of incubation within your body after exposure to produce symptoms. And so at that point, you were likely exposed right around the time you got the flu shot or right beforehand, and that's why you came down with the flu. The way the flu shot is designed makes it impossible for you to get the flu from the shot.
So say that again. After I've gotten the flu shot, I might feel achy. I might feel a little bit under the weather, and that's a good thing.
Absolutely, because it means your body is responding to vaccine components and developing a really strong, robust immune response to it that will keep you protected throughout the entire season.
Okay, I wanted to make sure that I heard that right, and I hear that question all the time. People say, I got sick from the flu shot. Other misconceptions. Mercury. Is there mercury in the flu vaccine?
So mercury, or thimerosal, has been phased out of vaccines in the U.S. and in Europe. They are not present in childhood vaccines. But the concern with thimerosal, or mercury, was that there were initial studies suggesting that a lot of mercury is harmful to the organs, which it's true, a lot of mercury is, but the mercury present in these vaccines is microscopic. And like I said, in childhood vaccines, it's not present. And people are concerned of the link between mercury and child onset autism.
Let's talk about autism, because that's the other one
Yes.
that is a misconception. And this started from actually science. A scientist, I believe in England, talked about this years ago.
It was a very fraudulent study. So, science has a bunch of peer reviews, and he had manipulated the data to show this link. And subsequently, multiple scientists, labs across the world have tried to replicate his study and have failed, showing that there was no link between mercury or vaccines and child onset autism. So that myth has been completely debunked.
And the difficult part of that is that it really set back flu vaccines for several years because celebrities were even, touting the fact that their child may have gotten autism. I know Jenny McCarthy was out many times talking about this, making appearances on talk shows about the fact that, her child had autism and was fearful that it had come from a childhood vaccine.
The hard thing is this whole idea of correlation versus causation. Just because things might be somehow correlated together doesn't mean vaccines cause autism. At this stage, science doesn't exactly know what causes autism, but they know that vaccines do not. And vaccines do a lot more good than harm. Yeah, there are some people who cannot be vaccinated, those, with certain immune disorders. But for the most part, everyone would suggest getting vaccinated because it could protect you against polio, hepatitis, influenza, which we see are, children under the age of 5 being really affected by influenza this year. Vaccines can do a world of good and can protect you throughout your whole entire life.
I think we should take a pause and just talk briefly about the fact that if you are healthy and how getting that flu vaccine helps those individuals who have suppressed immune systems. Can you elaborate on that a little bit?
Yes, so in the field of epidemiology, there's a phrase called herd immunity, where if 95% of the population is vaccinated against, germ A or virus A, then the 5% of the population that cannot be vaccinated for whatever medical reason, that group will be protected by the larger group, because it means that germ cannot bounce around from person to person because the bulk of the population is immune. And so different bacteria, different viruses, that population percentage is different, but it's still upwards into the 90s. And so that's the goal that the CDC uses every year to try to vaccinate the population. Say, we need X number of people vaccinated. Let's target these groups so we can protect the more vulnerable groups. And so I view it, even with the flu is, yes, I'm going to get the flu shot because, my grandpa, is not in the best health. And yes, he will be vaccinated, but I feel I am morally responsible to do my part and to be vaccinated so that way I'm not exposing other people, because some viruses you can transmit even if you're not showing symptoms. And so it's that burden that I don't want to bear, and I know a lot of people don't want to bear.
It's really a population health issue, isn't
Absolutely,
it?
Absolutely.
And we hear that from providers and folks in infection control all the time, that you're helping others by getting the flu vaccine for yourself. So
right.
Kind of very interesting. One other misconception, and we're running out of time, but I do want to ask you about women who are pregnant.
Yes.
Should they be getting a vaccine?
They should. So there was a study that recently came out that suggested that there was a link between vaccines and miscarriages. But it was a very small study, and other scientists, again, have looked into the evidence, and they're not finding any of that same evidence. One of the important things is when a child is born, they can't be vaccinated against the flu until they're 6 months old. It's just, because their immune system needs to build up a little bit. But if the mother is vaccinated during pregnancy, those antibodies that she produces can be transferred to her fetus, so protecting that baby during development. And then even once that baby is born, those antibodies are produced through breast milk, and so that baby is getting the more additional protection from the mother. Other diseases work the same way. Baby gets that immediate protection until they are able to be vaccinated themselves. And that can make a world of difference when you're seeing 3-4-month-old babies coming in to urgent care with the flu. How their disease severity might really be determined by was their mother vaccinated or were they not.
Very interesting science. It's an amazing thing.
It is. I love it.
All right. Well, Megan, we appreciate your time.
Thank you.
I know you're a busy person with all the flu cases around and other issues too.
Yes.
And we could talk forever about this, but I appreciate your time here today. Megan Meller, she's an infection preventionist in infection control at Gunderson Health System. We appreciate that. When we come back, we'll talk about the opioid epidemic in our community, from heroin to carfentanil. That's on It's Personal, brought to you by Gunderson Health System.
Let's face it, when you've been in labor for 24 hours, you're not exactly pleasant. And it takes a really special person to guide you through. For me, that person was Missy.
Fabulous. You're doing great. You're doing great.
She was with me in the hospital at Gunderson her entire shift, and somehow she managed to keep me laughing. She never got irritated with all my questions and treated me like I was the only person who mattered. It's weird, but I felt like I'd known her for years, even though we'd just met.
Here we go. And...
Missy is an amazing nurse. And because of her, I am a very happy first-time mother. And she's why I'm taking classes in the local college nursing program.
Gunderson Health System uses the power of love plus medicine, making each patient experience as amazing as possible. Learn more about Gunderson hospitals, clinics, and specialty services at gundersonhealth.org.
Welcome back to It's Personal, brought to you by Gunderson Health System. I'm Chris Stoffer. Joining me now is Dr. Chris Eberlein, who is part of the emergency room staff, but really has probably made a name for himself in the community because You are constantly asked about the opioid epidemic that's happening not only in our backyard, literally in some cases, but also in the region, and we certainly hear about opioids across the country as well. We wanted to bring you in and kind of get an update on where we are in the opioid epidemic, if you want to call it that.
For sure, it's definitely an epidemic. It's really affected the whole country, and it's here locally, as everyone knows. And we've had, we're having dozens of deaths a year from this, and we have for several years now. And in fact, I unfortunately heard the latest numbers from last year were higher than the year before. So, people are still dying in our community of this. It's still a problem. We're still having to deal with treatment, lots of overdoses, lots of Narcan being distributed and given pre-hospital. So it's definitely still there.
What are you seeing in the emergency room? What's it like to be in there when a patient comes in showing those signs and symptoms?
It's always, they're difficult to care for from the standpoint that, oftentimes we can reverse it. If they get there soon enough, we can reverse it, they get better. The frustrating part comes with whether or not they want treatment, because oftentimes they don't. Despite almost dying, they will get up and leave. And then it can be almost as frustrating when they do want treatment, and then you have trouble getting them into treatment. And so that's something that we're working hard with, and we've got some new programs. In fact, there's one that we just got a grant for, a pilot program of having a counselor person that is in the ER, and if that can work with them immediately in that crisis setting. And hopefully when you've just overdosed, we're hoping that they're more receptive to getting treatment, and this person will help get them into the appropriate treatments and things like that.
They're going to be staffed right in the
They're going to be staffed right in the ER, yep, which will be great.
And that takes the onus off the provider who is busy with several patients at that time, or nurses that have several patients. You have the ability for a counselor to work one-on-one.
To work one-on-one with them. We've been having social workers too, but they're very, very busy, and this person will be just focused on this patient population.
It's really reached that level. All right. Talk a little bit about the numbers. The numbers that are coming into the emergency room locally, what we're seeing regionally, and certainly if you can, touch on what's happening nationally. What's being
the numbers are pretty much steady state for the most part. Although I think just anecdotally from myself, I think there's been a slight decrease in the numbers that we see come in the ER. But we know a lot of them are using Narcan at home that they're getting from the AIDS Resource Center and that they're purchasing over the counter. So the numbers are a little skewed because by the time they get to us, either their system of Narcan has failed or they didn't have it with them. And so, or the overdose didn't respond to the Narcan because they needed more.
Maybe we should touch base on Narcan a little bit. Narcan is the drug that is administered should there be an overdose, and it's kind of like, I don't want to call it a miracle drug, but in some ways it's a miracle drug.
For sure, and we are actually very fortunate we have a drug that has like Narcan, it's an antidote, and it really works. And so it will reverse a narcotic overdose.
It's amazing.
Yeah. And with very few other side effects. And so you don't have a big profile of other of contraindications for it and things like that. So it's a very safe drug to administer, and you don't even need a needle to do it. It can be administered via the nose, which that's great too. It's just a spray into the nose and reverses the overdose, which makes a big difference.
And you're talking about that drug being available in the community. That's something that is available behind the counter. You just people have to ask for it. Are they doing that? Are they asking for it? Is it in
some are, some are. The difficulty is with an addict, the behind the counter purchase of that is about $80, and that is several hits off of the heroin or whatever drug they're using. So they often weigh that and don't get that, unfortunately.
We're talking with Chris Eberlein, the emergency room physician at Gunderson Health System, on the front lines, really, of what's happening with the opioid epidemic. And you mentioned heroin. I want to bring up heroin and carfentanil. Can you talk about both of those and what they're doing in the community and how they're related?
Sure. So heroin is a very, very old drug. It's a natural occurring compound that's synthesized off the opium plant. And over the last 50 to 75 years, there has been synthetic opioids made. And initially, a lot of these were made off of good intentions. Fentanyl is one. The fentanyl is a great pain medicine that we use in the hospital setting all the time. If you've had surgery, you've had fentanyl. However, the potential for abuse of these medications is huge because fentanyl is, 100 times more potent than heroin is. And so we've seen that drift into our community. And now you've got carfentanil, which is 10,000 times more potent than heroin is. And part of the reason we're seeing this is because these synthetic opioids, because they're not plant-based, these are purely made in a lab, are produced in manufacturing labs, oftentimes overseas, and shipped in. And you can just imagine how much easier it is to smuggle in something that takes up 10,000 times the volume as the original heroin. So they smuggle these in, they dilute them down, they might mix them with heroin, but it gets down to the bottom line is that the users don't always know what they're getting. In fact, most of the time they don't. And their drug dealer's not their friend, they're there to make money, and they end up getting this drug that, if it's not perfectly cut down right, you're getting a drug that could be hundreds to thousands of times more potent than you thought, and resulting in a significant overdose and death.
And a lot of people, I don't believe, think that that's happening in our backyard, but it is.
It is. We've had a confirmed carfentanil overdose within the last 6 months in our community, and we're doing training on first responders and police, and because this drug is so potent, a single amount, the size of a grain of salt will kill you. And so you're talking something that you might not even notice, an officer's on scene. They might not even notice they got that on their hands. They go have lunch, gets on their sandwich, they eat it, they overdose. And so they rub their eye, gets in their mouth, they overdose. So these drugs are incredibly potent, and so a lot of it's awareness. So we're teaching law enforcement, first responders, people that go into the house with the county workers, what to watch for an overdose.
Again, we're talking with Chris Eberlein, Dr. Chris Eberlein, emergency room physician, but you also provide medical oversight to Tri-State Ambulance. You do have some specific insight to what's going on in the community for an EMT walking in the door. Mm-hmm. And what is it that you're attempting to train them? What do you, you can put gloves on, mm-hmm. but what more are you having to tell them to do to protect themselves as innocent, individuals walking into a potentially fatal, scene?
Yeah, it's difficult because it's a very hard job they have, and I'm a big advocate for what our people do on the street, always have been, and a lot of it is training to be aware of your scene. If you're entering an overdose area, make sure you're wearing the appropriate personal protective equipment, whether it be gloves, gowns, even sometimes, and mask, depending on the level of threat they feel is there. And then, a lot of it's the buddy system. You got to be aware of how your partner's feeling. If they start exhibiting signs or symptoms of an overdose, we have Narcan available, and fortunately we haven't had to use it on a staff member yet, but we're training for it.
Other communities, have staff been, exposed to this?
Yeah, there's been several officers in the country that have been overdosed by doing searches and things like that of cars and people.
Amazing. We're out of time, but I do want to ask you, what is it we can do as a community to help tackle the opioid epidemic? And I'm just going to throw that softball out there. I'm not sure if you have an answer, but
there's no one simple answer, but get involved in the community. We have our heroin illicit drug task force. More community members showing up to that is always good. And you get rid of the drugs, the extra drugs at your house. If you're not using those opioids, get them disposed of appropriately. And understand that when you go and you're meeting your doctor for pain control, question how much of that medicine you really need. And so a lot of this has to come back on the patient too to be an advocate for themselves in the community.
Chris Eberlein, MD, emergency room physician, and medical oversight with Tri-State Ambulance. Thanks for joining us.
Thank you.
And that wraps it up for this edition of It's Personal, brought to you by Gunderson Health System. I'm Chris Stauffer. Thanks for joining us.